So this was quite a big brief. So what we have done is put quite a lot of information into the slides, which you will get sent out afterwards, and we're going to try to summarise what the slides are saying. So Dawn and I are going to talk a little bit about the things that influence what we're doing to develop and support the social care workforce, and then Laura's going to talk to you particularly about one of the programmes which is around integration of learning across all our disciplines. So some of this information Cheryl's going to talk about when she gets to it, but what I wanted to show you first of all was what you already know, is that the social care workforce is a really complex workforce in terms of who makes up the social care workforce, and of course volunteers and unpaid carers are part of that workforce as well. So in terms of thinking about what we need to do to provide people with the right training and education for that, it can be quite complex. You know also, of course, that the social care workforce is the largest publicly funded workforce in Scotland, making up about 7.7% of all Scottish employment. So we're talking about a lot of people. So there's a significant amount of learning that's going on, both in the social care workforce, in the FE sector, who are represented here today, and we in the HEIs complement some of that through a range of things. So we run different courses and different modules which are around micro-credentialing for skills. We have new articulation routes into some of our honours programmes. We've got bespoke courses for the social care workforce. We've got work-based degrees, we've got postgraduate modules and courses to support advanced practitioners, and they sit inside and alongside our usual degree level and postgraduate provision. So we know that there are a number of changes in the population, and that means there are increasing demands within a constrained financial environment. So training and educational provision is under reform to ensure that we're providing a flexible and confident and competent workforce with relevant and appropriate qualifications. Is that not the right slide, Dawn? You're looking at me confused.
I'm looking at it. We had some really pretty picture slides which seem to have vanished, but we've thrown a few extra ones in. I think there should be more before that one, isn't it? They've disappeared.
They have disappeared.
Okay. So what we wanted to say at this point was we felt it was important actually that we allow Laura most of the time to speak this afternoon, because she's really going to give you an example of how we educate our students, how we're really preparing them for the current challenges that are being faced in social care. But what we wanted to do, we had some nice pictures that you've not got the opportunity to see today, but we can maybe get them, was to really put everything in context. We're not working in isolation here in the university. We are making sure that our curriculum is very responsive to the demands that are being faced across health and social care. And what we wanted to do was really reflect that we've got a number of drivers. We've got social drivers that I'm sure you're all very aware of. I'm not going to go into it too much. We've got the ageing population, we've got workforce challenges, we've got opportunities to work. We need to work across health and social care. We're needing to look at new models of service delivery. We've got costs, we've got lots of challenges out there. And then we actually have all the policy drivers, and we weren't going to take an hour of telling you all about the different policy drivers, but we picked up a few key ones, which there was a picture in case you thought we'd maybe miss them out. So obviously we've got the 2020 vision. And what these policy drivers we felt we wanted to explain to you to do were, they were not just showing how services should be delivered, but also how the workforce should be, what the workforce should look like. So if you jump back one, sorry, Janine. So really, hopefully this is familiar with how you're working, but we really wanted to emphasise when we're thinking about our students and our students' education, the things that we're having to think across health and social care is that it's integrated. We're not just looking at one service in isolation, but there's very much this focus on preventative health care. We're looking at the public health inequalities, keeping people healthy and well and at home as far as possible. Some of the other points was again about quality, safety. These are all things that we're absolutely instilling in our students, so when they're coming out, they're not just looking at delivering services as they are, but they're looking, is this the best way? What supports this? What's the evidence for it? And keeping people at home. That's what we want, or in a homely environment. So that's really the 2020 vision for what services should look like. And then our workforce, if we jump on, We've seen a few versions of this as it gets updated, but where we're at the moment is the 2020 vision was currently is looking at a sustainable workforce. So our students, we need to make sure are promoting health, well-being and resilience. We want capable workforce, so able to work across all these different boundaries that are out there. And that's not just within the NHS or the social work, it's across all sectors, as you know. And be able to work in partnership and in co-production with all of the stakeholders. If we jump on the next one. Now, I sit in the School of Health Sciences, so that's the allied health professions, and I've just used this as an example. This is the sort of professional drivers that we're working with now. Janine and Laura could have come up with their own, but for me it was about highlighting these sort of key actions that we're asked to do. So again, it very much aligns with the 2020 vision. We've got the contribution to public health. It's about showing everybody's role within there, about looking at the personal outcomes approach when we're working with individuals, and that's very much what Laura does within the interprofessional education. Prevention is back in there, working across all the partnerships. Technology's in there, how we use technology. It's not that technology is absolutely driving, it's how we use it and work with technology. And a better understanding of each other's roles, and I know Laura will talk a little bit more about that. Partnership working and multi-agencies. It's not just multidisciplinary, it's multi-agencies. It's working with everybody. We need to be able to do that. We're not working in silos. So we wanted to just emphasise that. And again, I'm sure you're aware of the sort of trilogy of national health and social workforce plans that we've got there. So we've got 3. We've just picked out some of the key ones. There's obviously many pages within these documents, but for us, some of the key things that we're thinking about was recognising the roles of all the different disciplines. And, you know, it's not just, I suppose, about saying it's about social work, it's about all the disciplines, AHPs, nursing. But we've got some challenges there that we're going to speak about a wee bit more. We've got recruitment issues, we've got workforce shortages, and how do we hold on to staff? How do we get them to recognise this as a career, keeping people within the workforce, retaining the staff, career progression? How do we build in opportunities for career and developing people's careers? And how do we improve training and education so it's responsive to what's going on? And Janine mentioned about micro-credentialing. There's a number of things that we're doing. The university is not just about degrees, it's about opportunities for meeting different training needs. So we're building that into our curriculum as well. I think there's maybe one more, Janine. Is this still me? Yes, I think it is. So we're building in for training and education. It's really important that we think about the competence of our workforce. We don't want them just to be able to address problems. We need them to be flexible, to be competent, to be able to work in different ways as required. And there was that one there about the frameworks, that there is professional frameworks that we must be aware of when we're educating our students. So there's social work one, we've got all the different professional frameworks, but I think all of them are talking about the need for career progression and for being able to take on different roles, working in different ways, and advanced roles as well, while we deal with the other shortfalls. And that was me.
Okay, thank you. So I suppose the bit that we should say as well is health and social care isn't unusual in having skills shortages. We have a number of skills shortages across Scotland, but specifically for us, I suppose it's about the integration agenda along with the transformation agenda that Dawn has been talking about, is making sure that what we do is it means we've got a workforce equipped for now, but also for the future. And that's within the specific context of Scotland's geography and within the financial constraints that we've been talking about. And there was a pretty slide there which would tell you what all the other skills gaps are, but instead we have a not so pretty slide which is telling us about them as well. Those won't be of any surprise. That comes from the National Workforce Plan. Okay. As does that. I'll let you read it.
I think that's a nice summary, really, of what we should be aspiring for.
Absolutely.
It definitely informs what we're doing.
And so these elements here in terms of a skilled and valued workforce are things Laura's going to pick up on in about 1 minute's time. But just to say very briefly, there are a number of things that we do to prepare students for practice. So we have a number of discrete modules that are around the challenges, the complexities that our professionals will need to work with. But there are also a number of integrated modules where students across disciplines come together to be educated and assessed. We have workshops and visiting speakers. We have some education partnerships where we actually pay practitioners to come in to be part of the teaching teams to make sure that we really are equipping students for the world of work out there. We've also got a number of integrated placements. Some of our professions have been integrated for many, many years, but we have things like dietetics and radiography who are now moving into more integrated placements. We have a greater use of ICT, and an example of that would be the School of Nursing, and they have an online virtual community that they're involved with, and students involved that they can create scenarios, and students work their way through those kind of scenarios too. But the thing, I guess, that one of the things that we're most proud of is our interprofessional learning programme, and we're going to hand over to Laura, who's going to tell you much more about that.